Okay. Good morning, everyone. Today I will mainly discussing about voluntary assistance, also known as VAD, within the context of palliative care. This presentation will critically examine the ethical consideration for both for and against VAD using the four ethical principle of benevolence, non-malfeasance, autonomy, and justice. And I will also discuss how healthcare professionals can ensure quality care for patients who choose VAD. And this is my student number and my name. So, firstly, voluntary assistance refers to a legal process that allows eligible terminally ill patients and voluntarily assess medication to end their life under strict legal safeguard. In Australia, VAD is now legally in all states, and also legislation and eligibility criteria differ slightly between jurisdictions. Patient must have decision-making capacity and incurable illness and incurable suffering. So, uh, one of the strongest ethical arguments supporting VAT is for autonomy. Autonomy refers to a patient's right to make informed decisions about their healthcare and body. Supporters argue that terminally ill patients experiencing unbearable suffering should have the right to decide how and when they die. VAT provides dignity, independence, and a sense of control during the dying process. So, many patients fear prolonged suffering, loss of the independence, and reduced quality of life. Therefore, having the option of VAD may reduce psychological distress and also improve emotional well-being, even if patients ultimately do not choose to use it. This reflects the independent importance of patient-centered care and informed decision-making in modern healthcare. However, there are also strong ethical arguments against the VAT based on the principle of non-malfeasance. So, uh, about the non-malfeasance, which means healthcare professionals should avoid causing harms. Traditionally, the role of healthcare worker is to preserve life and relieve suffering without intentionally causing death. Opponents argue that assist dying may conflict with the professional values of medication and nursing. Some healthcare professionals experience moral distress because participation in invading may conflict with their personal belief, religious values, or ethical principles. And another concern is possibility vulnerable patients feeling pressure into choosing VD due to fearing of becoming a burden into their family or financial stress, social isolation, or inadequate support systems. Critics also raise concerns regarding the slippery slope and arguments where eligible criteria may gradually expand over time. And the third principle is about benevolence, which means acting in a patient's best interest. Supporting of VAD argues that when suffering becomes unbearable and cannot adequately relieve, helping a patient to die peacefully may represent compassionate care. Also, palliative care can effectively manage many symptoms. Some patients continue to experience refractory pain, breathlessness, psychological distress, or existential suffering despite optimal treatment. In this situation, VAD may be reviewed as a way to reduce suffering and preserve dignity at the end of their lives. However, opponents question whether intentionally ending life can eventually be considered beneficent care. Palliative care philosophy traditionally aims to neither hasten nor postpone death, but rather improve quality of life until natural death occurs. Uh, the final one is about justice. So justice is related to fairness and equitable access to healthcare services. Supporters believe all eligible patients should have equal access to VAD, regardless of geographical location, cultural background, or socioeconomic status. However, there are concerns that access to palliative care services remain unequal across Australia, especially in rural and remote communities. Some patients may choose VAD because they cannot access or have enough adequate symptom management or psychological support. This also raises a important ethical issue becoming patients should have access to high quality palliative care before considering a VAD. Justice also involves in protect vulnerable population from discrimination, coercions, or healthcare inequalities. So for patients who for patients who elect a VAD, care, maintaining high quality care remains extremely important. Choosing VAD should never reduce access to holistic care services. Patients still remain symptoms management, emotional support, spiritual care, and patient central care about the end life process. So healthcare professional, I think, should be provide respectful housing should be housing professionals should provide respectful communication, shared decision making, and culturally safe care. Nurse plays as an essential role in advocating for patients' wishes, maintaining dignity, supporting families, and managing symptoms. Family may also experience guilt and uncertainty or emotional distress and during the VAD process. Therefore, compassionate communication and bereavement support are very important for the components of high quality and reliable care. So I think nurses also are the central to the process because they often spare the most time with patient and families. Nurse uh nurses should have strong support emotional well-being, provide education and advocate for patients' autonomy and maintain therapeutic relationships. However, nurse also can experience some moral distress if VAD conflicts with their personal values. Australian registration therefore protects the right of healthcare workers to conscientiously objection while still ensuring patient access to care. So, uh, in conclusion, I think voluntary assistance remains one of the most ethically complex issues in palliative care right now. The principle of autonomy, benevolence, non-malfeasance, and justice may both support and oppose really depend on ethical interpretations. And supporters focus on dignity, compassion, and patient choices, while opponents emphasize their preservation of life, professional responsibility, and protection of vulnerable populations. So, regardless of personal opinions about VAD, I think healthcare professionals must continue providing compassionate, respectful, and high-quality palliative care for all patients. It's about our professional and it's about respect for patient. So nurse also play an important role in supporting dignity, communication, emotional well-being, and ethical care throughout the patient their final journey for the end of life. And that's it. And this is my reference. Page 1, page 2, and thank you so much.